Welcome everyone. I thought I would do a quick little video on the anatomy around eyes and how you can massively reduce your chance of an eyelid ptosis. I got one sent to me again via private message, someone who caused one, and we had a little chat about what can be done to reduce the risk, and I thought I should share that with everyone as well, because it's very upsetting for patients. Even though it's actually something that gets better on its own and it's often quite mild, it's not, if you can avoid it, why not? So this is what I know about how to avoid an eyelid ptosis. The published data says that your risk is 1 in 100. Our experience at Skinbeer is about 1 in 10,000, and it's exactly because of what I'm about to teach you here. So it should help you a lot see less of these if you've had a problem with them at all. So it all starts with the corrugator muscle. So we'll have a close up. I've got Miranda here is helping me demonstrate the anatomy. If you do a big frown for me. Now this is the muscle we're trying to treat. It's the corrugator muscle, and there's also depressor supercilii and depressor and your procerus muscle in the middle. But primarily it's the corrugator muscle, which you can normally see inserted in the surface of the skin here. If you do a really big frown, you should see an insertion point. It's a little insertion point just there, not very strong, but it's there, and then it's attached to the bone deep and medially here. And that's very important because we're starting out deep and we're becoming very superficial, and that's exactly the knowledge or anatomy that's going to help you reduce the risk of an eyelid ptosis. But before we get on to that, let's talk about what actually happens with an eyelid ptosis. And for this I have this little model which I just made out of blue tack. So the big thing that I think, the big mistake people make when they first start is, if this will open as well, we learn the anatomy in 2 dimensions, and you look at a picture like that and you think, oh look, there's the muscle, the levator palpebris superioris that lifts the eyelid up, and you almost imagine it unconsciously. I think often as you imagine that the closer you get to the eyelid, the more chance you're going to have of affecting this muscle. But actually the point I want to make most of all today is that this muscle, although it looks in the 2-dimensional picture like it's in the eyelid, it actually tracks back into the head, and you can see it if you imagine this being the eyeball. It's actually attached right at the back of the eye socket, and that's where you've got to get Botox into in order to cause an eyelid ptosis. So how does this happen? And it's all about depth here, because if you look at the corrugator muscle, which we've just had a look at from round frowns again, so this is the little muscle that's contracting. If you go all the way through that muscle and out the other side, you end up quite deep, and once it's deep, it tracks into the eye. So it's the depth of your final injection that causes the problem. And once you know that, you will quickly develop a strategy, which I'm going to show you now, to reduce the risk of that. And it's around making sure that you inject deep where the muscle is deep and strong, and superficially and weak where the muscle is superficial and weak. So it's just literally following the detail in the anatomy and knowing that depth here is a problem. So let's show you. First I'll just show you, if we were to mark out Miranda's face, if you do a big frown for me again, we might choose 1 in procerus, 1 in the thickest part of the corrugator, and 1 in the medium part of the corrugator. And sometimes it's arguable that a small light dose right superficially might be okay. But remembering that these injections are the danger point, this is where we've got to think about being more superficial. I'll show you on the model. So I know lots of you will probably want to have seen an injection, but I'm just going to show you the injection on this model instead, where the final part of the muscle where it's inserted is probably quite fibrous, so there's no need to put a lot of Botox there. There's a little bit of a twitch, and sometimes if you don't treat, you get a little tiny pull in that area. So this is where you put a very superficial, so if you imagine going through the dermis, the first thing you're going to hit, even within the dermis, actually is the insertion point of the muscle. So you can go really superficial, something like that is fine. So you're just almost resting on the top of the muscle, and I would probably put 1 unit there. Over here, you've got a much thicker, stronger muscle, and it's deeper, so you're actually you're also safer, you're further away from the eyelid, and so you could go all the way in, down to about 1 centimetre. Don't touch the bone or anything, it's about 1 centimetre deep, and there you'd put your 4-unit dose. And in between will be something in between, so you might use a 3-unit dose at kind of mid-depth, while, of course, the other thing I haven't mentioned yet is you should be compressing the orbit the whole time. So I'll show you that as well on Miranda so you can imagine it. You press your head back for me. So during every injection, it should be a fairly fundamental part of all training that you put a decent amount of orbital rim pressure here, and you can see why now, because if I've gone slightly deeper than I meant to, and I go underneath the muscle, at least if you have a finger here, you're also reducing the risk of Botox getting into the orbit, settling on that levator palpebral muscle and then causing a droopy eyelid. So number one, always compress the whole time you're injecting. Number two is get your depth right. Deep and strong dose in the middle, higher superficial and weak dose laterally, so only about 1 unit or something like that. And that you should see your rates of ptosis come right down, if they're anything like ours, to about 1 in 10,000 instead of 1 in 100. So I hope that helps. I don't know if we had any questions or anything yet, but if you found that helpful, please tag someone who might also find it helpful, or you can share it. I really appreciate that. I love the comments, and anything you ask or anything else you want me to clarify on, I'll try and either weave it into another video or just come underneath and explain it to you. But do let me know what you think. If you had your own thoughts on it, or maybe share what you were taught in your training, that's always useful to know. And hopefully we'll all get better together. So hope that helps.